But when it comes to ultrasound, remember it with an, this kiwi diagram. So it will be easy for you to remember. Those who are new, please use this analogy to understand the longitudinal or the sagittal axis, or the axial or the short axis. So if I am going to divide this kiwi into two halves, okay, so that is your longitudinal axis or the sagittal section. Now it depends on me where I want to cut this kiwi. Do I want to cut it here, 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 here? It depends on me, right? So that is what is your longitudinal axis or the sagittal section in ultrasound. I'll be just showing you in the demonstration, but before that, just have a look. So if I have to scan the forearm muscles, okay, so how my forearm muscles are? Like this. So straight, like that they are going, okay. So now if this is my aspect marker, if I have to look for the sagittal section, how I am going to keep my probe? I am going to keep the aspect marker in a craniocaudal direction. So I am looking at the longitudinal axis of the forearm muscles. I have seen people holding it like this as if they are going to stab the individual, or it is such a, delicate thing that they'll be holding it from here. So this is absolutely wrong. Please do not do it. So one axis is not at all convincing to just say that this structure is pathological. It has to be two axes, okay? I have set a depth of 3. So whenever we are, scanning a structure, first of all, that structure should be visible to us very nicely. That is the first step. Second step is, you should not be having so much of dead space off the screen. This is absolutely wrong. You should never be doing it, okay? Then there are two ways of performing an intervention. One is in plane and another one is out of plane. Now, let us quickly go through the structures. So we learned that we are having the topmost layer, which is this layer. Okay. So topmost layer will be what layer? Skin. What is the ecotexture of the skin?
Hyperechoic.
Hyperechoic.
Why? Why it is hyperechoic?
Subcutaneous, it's got
Yes, it has got all the connective tissue. So nerve in the short axis, what kind of appearance it will have?
Honeycomb appearance.
Honeycomb appearance. Very good. And if this is a muscle, now this structure which we are seeing, what is this? It is casting an acoustic shadow.
Fold.
Are you able to see this structure nicely? Now, if I'm going up, just concentrate on this structure. I'm following this structure alone. What it has turned out to be?
Muscle.
Muscle. Now concentrate on this structure. How is the look?
Blood vessel. Blood vessel. It is pulsatile. It is pulsatile.
Now I'll be doing one maneuver.
It is non-compressible.
Yes, it is pulsatile. It is non-compressible.